Over the past 20 years, I have watched with fascination how health and productivity management has evolved since I first started doing research on the topic in the early 1990s. In the early days of HPM, the discussion, particularly for larger employers, focused on the integration of occupational and non-occupational disability. But it didn't take too long for employers to realize that if you're absent from work on disability, then maybe absent from work at all matters. And so we saw a broadening of the conversation into a focus on absence management. But given what was going on with healthcare costs and the fact that absence, after all, is a health issue, group health became part of the mix. And again, not further down the road, wellness and prevention became part of the conversation about health. But the striking thing about this evolution is almost the sole focus on cost as the primary issue, regardless of how employers got involved in the conversation. Even as lost productivity has been brought into the framework, cost remains the central theme of the conversation of health and productivity. Now, it's not that cost isn't important. We all know cost is critical, impacts the employer's bottom line. But it strikes me that we often miss one of the key aspects of health, and that is health in all of its dimensions, including absence and performance, influences the ability of the company to be successful through its people. That is how health and human capital drive business performance.